is Seth from the Center for Thyroid and Parathyroid Surgery, and in this video we will be discussing an ethanol ablation. An ethanol ablation is a procedure performed in the office with the goal of shrinking a cystic or fluid-filled thyroid nodule that is either causing compressive symptoms, which includes pressure in your neck, difficulty breathing or swallowing, or for cosmetic reasons if that nodule is popping out through the neck and visible. Not all nodules, thyroid nodules, are candidates for an ethanol ablation. Your thyroid nodule needs to be predominantly fluid-filled or more than 50% fluid-filled or cystic, and that fluid needs to be on all one common compartment. It cannot be in all smaller little cystic spaces. In order to deem your nodule a candidate for ethanol ablation, it needs to be evaluated in the office with an ultrasound. If your nodule is appropriate for an ethanol ablation, it is again performed in the office. You're seated in a chair and you lean back into a comfortable position, and then the skin overlying the thyroid nodule is then numbed. In order to numb it, you feel a pinch from a needle going through the skin, followed by a burning, stinging sensation as that numbing medicine is injected. That sensation lasts for about 1 to 2 minutes and goes away. It feels like a quick bee sting, which is usually the worst part of this procedure. Next, I use an ultrasound to visualize and guide a needle directly through the skin into the thyroid nodule and into the pocket of fluid. You should not feel the needle go through the skin because it should be numb. Unfortunately, I cannot numb everything deep in the neck or inside the thyroid. As a result, when the needle goes deeper, you may feel a little bit of pressure or a little bit of discomfort. Whatever you feel can sometimes spread or radiate to your jaw, ear, or head. The reason being all the nerves in the head and neck are connected. So if that happens, don't worry, I promise you this no one will go away. The needle's in place for 1 minute or less in order to extract or aspirate or suck all the fluid out. Next, the needle is kept in position, but the syringe is screwed off with all the fluid that was aspirated, and a new syringe is screwed on that has an alcohol in this syringe. Now, if you extract just the fluid, there's a very, very high chance that fluid will come right back and the procedure won't work. So in order to prevent the fluid from coming back, we will inject alcohol, a strong alcohol, which we call ethanol, into that pocket where that fluid was. That alcohol will encourage that pocket to scar down on itself and make it less likely for the fluid to come back. So while, again, keeping the needle in the same position, screw the old syringe off with that aspirated fluid, and a new syringe on with that ethanol, and then using the ultrasound still to confirm the needle's in the proper position, I will slowly inject the alcohol into that space and visualize it to ensure that the alcohol is going into exactly where we want it to go. As the alcohol is being injected, you may experience a little bit of pressure and sometimes very rarely a little bit of a burning sensation. I will be talking to you throughout this entire process, letting you know what's happening and you giving me feedback to let me know that you're able to tolerate that. It takes about 1 to 2 minutes to inject the alcohol slowly into this pocket, and then that alcohol is left in place for about 2 to 3 minutes. Afterwards, I extract all that alcohol and take the needle out. The entire process takes 5 to 10 minutes at the most. Afterwards, I clean you off and put a Band-Aid in the site where the needle came in through the skin. That Band-Aid can come off the following morning. Once it comes off, you may notice a little bit of swelling or bruising in that area, which is completely normal. If present, should resolve over the course of several days. You can expect to have a little bit of soreness in that region for 1 to 2 days. There are no activity restrictions following the procedure. You can drive, eat, drink, exercise. You can even drive yourself to and from the appointment. Afterwards, you come back to the office 6 weeks later for repeat ultrasound to ensure that that fluid has not reaccumulated or developed again. Risk for this procedure include the fluid in your thyroid nodule being too thick, too viscous to extract or suck out with the needle. Unfortunately, we will not know about that until we actually inject the needle, pass the needle into the fluid, and we have difficulty sucking that fluid out. Unfortunately, we cannot appreciate that or anticipate that based on any sort of ultrasound appearance. So there's a small chance that I cannot even extract the fluid from the nodule. There's another risk that by putting the needle into the thyroid nodule, it can cause bleeding at the time of the procedure. If bleeding is occurring, it makes the alcohol ablation, the ethanol ablation, ineffective, and we have to abort the procedure right then and there to make sure the bleeding stops and potentially bring you back in the future to try to repeat the procedure. Other risks include the fluid coming back. Even despite using the ethanol and using a proper technique, sometimes the fluid may come back. That could be partially or it can be completely. If the fluid comes back, you have the option of a repeat ethanol ablation. Typically, if there was a partial response, it's worth trying again. If there was no response, then the chance of it working in the future are fairly low. If the ethanol ablation doesn't work and you're still symptomatic, then that's when we usually will consider the role for surgery at that point in time. Other risks include infection. Anytime you put a needle into a pocket of fluid, there is a chance that you could cause infection. Signs of infection would be swelling, redness, discomfort in the neck. You call the office right away if you're experiencing that. We treat that with antibiotics, which typically resolves it. You do not need to routinely be on antibiotics. There is a 1% chance of bleeding by putting a needle into the nodule, as we discussed a little bit previously. That risk is higher if you're not on any blood thinners. If you are on multiple blood thinners. If you are, we may ask you to stop those blood thinners with the permission of the doctor that's prescribing them to you prior to you undergoing the procedure. If there's signs of bleeding, you would notice swelling and prominent bruising in the neck that could last up to 1 to 2 weeks. Very rarely is that bleeding significant and require admission to the hospital to watch you very, very closely. That concludes our video on ethanol ablation. If you have any other questions on thyroid nodules or any topics about thyroid and parathyroid glands, please visit my website, sethkaymd.com. Again, that's SETHKAYMD.com. Thank you very much for watching.